My name is Dana House. I'm a research coordinator from Newfoundland and Labrador, Canada, and I work on the PriCARE study, which we're going to tell you a bit more about in a moment. I'm co-presenting today with two patient partners on the PriCARE study, Judy Porter from Nova Scotia and Andre Gaudreau from Quebec. I'd also like to acknowledge the other co-authors of this presentation who are listed on this slide and who are all members of the PriCARE research team. In the next 10 minutes, we're going to tell you about our research team's experience of patient engagement that happened within the larger PriCARE study. But first, Andre is going to present a definition of patient engagement.
Definition: patient-oriented research is the act of meaningful and actively engaging patient in government, priority setting, developing the research question, and even performing certain parts of the research itself.
We know from the literature that health researchers are increasingly engaging patients and their families as partners in the research process, from inception to knowledge translation. This trend will continue to grow as more health researchers and funders recognize that studies which meaningfully integrate the patient perspective will make better use of available resources to produce more relevant evidence that can be implemented in clinical settings. The emerging literature elaborates strategies and best practices and outlines the benefits of this approach, which include the undertaking of more relevant research, improved participant recruitment and retention, the use of research instruments that are better suited to patient populations, and enhanced interpretation of study findings. Nevertheless, the literature suggests researcher attitudes toward patient engagement are mixed, and it points to challenges and barriers to patient engagement, such as uneven power dynamics, time and resource commitments, differences in knowledge and goals, and the work required to building good working relationships. Few studies, however, consider the experiences of patient partners and researchers who are working on the same project. The PriCARE study allowed us to examine patient engagement from all perspectives on the research team, and we will present some of our key findings today.
This study of patient engagement was conducted within a larger 5 provinces research program called PriCARE, which is studying the use of nurse-led case management intervention in primary health care from patients with chronic medical condition and complex health and social needs who tend to be frequent user of healthcare. Our team is examining how, for who, and under what condition case management can be used to improve outcome from frequent user and achieve efficiency in healthcare.
As the different patient partners joined the team, we all came in at different times and with different expectations of how we would be involved. Add this to the research team having different expectations, and voila, the challenges began. We were fortunate that we were able to work through our trials. The problem is that we were all looking at the project through different lenses. None of the lenses were wrong. We were just coming at it from different directions. The challenge is, how do you allow the unregulated life experiences of the patient partner into the fixed standards of research? It's not simple. One example of my biggest issue was a questionnaire that was being given to participants. As a patient partner, I saw some issues with it. One question asked, how would you rate your health? The answer is one single number. Remembering that this is a project for people with multiple chronic diseases, I'm one of those such people, I thought to myself, how in the world would I answer that? I have a different answer for each one of my conditions. And there were several questions along those same lines. When I and the other patient partners brought this issue to the project team, we were told that it was a validated questionnaire and it could therefore not be changed without compromising the utility of the data. There was a schedule to keep, and they weren't comfortable with not changing anything. At this moment, I wondered why I was there. Was I a token patient partner? The patient partners persisted, and eventually the lead principal investigator encouraged us to talk about this. We formed a committee, and we created guidelines for administering the questionnaire to address some of the concerns with the tool, which included advice and prompts for the interviewer. This helped a lot. It wasn't easy. It was messy, but we worked it out. We were flexible.
And as with the larger PriCARE study that Judy just spoke about, we also wanted to bring both researcher and patient partner perspectives to the sub-study of patient engagement, so we could understand its challenges and successes from all angles and learn from the experiences of not just the patient partners who were engaged in the work and contributing their experience and life experience, but also from the researchers who had varying degrees of familiarity with patient engagement and whose established ways of doing research may have been disrupted. The qualitative patient engagement study involved interviews with 22 members of the research team, 7 patient partners, 8 coordinators, 2 co-investigators, and 5 principal investigators. In-depth interviews were conducted by 2 research assistants who were external to the PriCARE team, and they used interview guides that were co-created by researchers and patient partners. Transcripts from the researcher interviews and a summary of the patient partner interviews were analyzed thematically by coordinators of the PriCARE team, who were working with the patient partners. Finally, the coordinators and patient partners collaborated to review emerging analyses and validate the final findings, which we've organized into 4 themes.
So one of the first themes here is evolving relationships. Time must be given to encourage relationships to grow. Flexibility must be exhibited by everyone. This will be much easier if role expectations are clearly defined at the beginning of a study, but also revisited throughout the study to accommodate changing people and circumstances. Flexibility also means understanding that not all patient partners want to be involved in all aspects of a research study. Second theme would be environment that fosters engagement. Who wants to draw attention to themselves in a place where you already don't feel welcome? Who wants to make themselves vulnerable and share what might be a very personal example of their life if they feel that they're in an unsafe environment? Welcoming spaces where everyone feels confident and has the opportunity to speak and be heard are critical to meaningful patient engagement. Thirdly, balance. Finding the balance between following research standards and introducing personal experiences is hard, but it's worth it in the end. Both researchers and patient partners must walk this tightrope, understanding each other's role and giving mutual respect for their knowledge that they bring to the study.
And finally, impact and value of patient engagement. Our study found that patient partners enhance health research in many ways. The PriCARE team saw how patient partners bring a patient lens to research materials and processes to improve participant enrollment and experience. We also saw patient partners bring a unique perspective to data analysis and interpretation, keeping that focus on key implications for patients. We're also benefiting from the patient partners' creative and effective ideas for knowledge translation and their understanding of what patients and clinicians need to know and how best to share it with them. So in conclusion, both the researchers and patient partners on the PriCARE team recognize the value of patient engagement. We all agree that patient engagement works. The definition of patient engagement that Andre presented earlier indicates what it should look like and involve, but it doesn't give much insight into the actual how of meaningful patient engagement at all stages of the research. This sub-study of our team's patient engagement experience has highlighted some key strategies for effective patient engagement, which include early and continuing training in the patient engagement approach for all team members, institutional support and infrastructure from funding agencies and academic institutions, and finally, clear expectations for all team members, combined with the flexibility to adapt as needed. That brings us to the end of our presentation. Thank you very much for your time today. We welcome you to reach out to us if you have any questions.